How to train your bladder. If you're someone who constantly going to the bathroom, always looking for the bathroom in public places, you might have overactive bladder, but you can train your bladder. Overactive bladder is the condition when the bladder muscles contract uncontrollably and our brain perceives it as the urge to go, even when our bladder is not full. Let's say you go to the bathroom every 20 minutes. So we're going to start small. Whenever you feel the urge to go, you contract your pelvic floor, do the Kegels 2 or 3 times. It will buy you a little bit extra time, and you're going to wait 5 minutes before actually going to the bathroom. Next time the urge comes around, you again contract your pelvic floor, wait 5 minutes, and then go to the bathroom. And do it for the whole week. After the week, your bladder will adjust and get a little bit more comfortable with those 5 minutes of the wait time. So next week, you'll wait 10 minutes. Urge comes around, you contract your pelvic floor muscles and wait 10 minutes. You do it for another week. The next week, you will increase to 15 minutes and so on. So you can do it until the interval between going to the bathroom will reach the appropriate time. And what is the appropriate time? On average, it's normal to go to pee every 2 hours. So once you're there, you can stop and just go to the bathroom every 2 hours. But what to do if every night before going to bed, you keep going to the bathroom and it feels there is something else is left and you need to try to empty it as much as possible, and you're already making a 3rd, a 5th, or 7th trip to the bathroom? Well, it's very important to realize that there is nothing in the bladder. And next time the urge comes, you just contract your pelvic floor and just make a decision to go to bed. It might be difficult at first, but trust me, after a few nights doing this routine, your bladder will stop bothering you. And remember, training your bladder also involves training your brain. Along with the bladder training, there are some bad habits that we need to untrain. For example, going to the bathroom just in case, not when we actually need to. The reason behind it, if you go to the bathroom when your bladder has just a small amount of urine, will train your bladder to perceive that small amount as the full bladder, and it actually will make your urgency and frequency worse. And another thing to keep in mind, the frequency of your urination will depend on your water intake. So the more you drink, the more often you will need to go to the bathroom, because water will need to go somewhere. So if you're drinking tons of carbonated drinks and coffee, you will have more urgency and you will go to the bathroom more often. So keep that in mind when you're doing your bladder training. And sometimes it helps to think about the numbers. For example, an average person produces less than 1/3 of the cup of urine per hour. Obviously, if you drink more, have more carbonated drinks, you're gonna make more urine, but the average is less than 1/3 of the cup per hour. Average bladder can hold about 2 cups of fluid. So technically, you can have up to 6 hours between the bathroom breaks. The average person will go 2 to 4 hours between bathroom breaks, so they don't feel like they have to burst. If you're someone who always looking for the bathroom wherever you go, you might want to start with training your bladder and see what happens. Because if that works, it might help you avoid medication or any further interventions.